Welcome back to another episode of Midnight Mental Talk. I'm Adrienne and my co-host is Leanne. This week we're actually bringing you a topic that is a disorder that affects the person's personality and also disrupts their personal lives. Leanne, why don't you explain to us exactly what borderline personality disorder is?
Alright Adrienne, here it is. This particular mental illness pretty much kicks a person in their own ass every day by causing unstable moods, relationships, self-image, and behavior that can be seen by both family members and people they work with. Essentially, the disorder makes a person unable to regulate emotions, and it affects about 2% of adults, the majority being young women, as stated on mentalhealthcanada.com.
With borderline personality disorder, there's a high risk of self-injury behavior as well as suicide attempts. This is if the mental illness is severe enough. Why don't we go and talk about the main symptoms now, shall we, Leanne?
Of course, Adrienne, and I want to point out that BPD symptoms differ from those with depression or bipolar disorder. BPD causes a person to have extreme shifts of emotions such as bouts of anger, depression, or anxiety that simply last a few hours. A person could also show signs of impulsive aggression, drug or alcohol abuse, cognitive distortion, which can also lead to constant changes in their career, goals in life, friends, and so on.
Another symptom of borderline personality disorder is when a person feels unworthy, mistreated, or misunderstood. They feel bored, empty, and may not know themselves anymore. A person with borderline personality disorder may also show signs of excessive spending, binge eating, and promiscuous sex. Now, I like to remind you that we're only touching the surface of this disorder, and we would like to remind you to educate yourself the best that you can.
Treatment options for BPD include therapy sessions. However, the website listed below says it's only partially effective. However, there has been a treatment specifically designed for borderline personality disorder developed within the last 15 years, called dialectical behavior therapy, DBT. And of course, medications go hand in hand in helping a person recover.
I would like to point out that the cause of borderline personality disorder is not quite known. However, they feel like that environmental factors and genetic factors play a key role in the development of the disorder, as well as a history of abuse and neglect. 40 to 71% of those with borderline personality disorder have reported being sexually abused. So perhaps environmental stress can actually be a trigger for the onset of the mental illness. But who knows? I don't want to speculate too much. But if you'd like to do more research on the subject, there is actually going to be a link below in the description box. So go on over there, and that website will actually go further in depth in the subject for you.
Thanks, Adrienne. I think that wraps up another Midnight Mental Talk, and we ask you to subscribe to our channel if you enjoyed what you saw and you want to stay updated for every new video that we make, usually on Mondays. Thanks for watching, and we'll see you next time.
Thank you for watching, everybody. I hope you guys enjoyed this video, and we'll see you next week. Bye.